So let me tell you a little bit about what we do. And this is, everybody knows what the elevator speech is for your organization. If you get somebody that could be a top funder for your organization, you have to figure out what to say to them in the elevator between the 1st and the 9th floor. That's all the time you got. So what is your short, concise message? And CCAR organizes the recovery community to do 2 things. We put a face on recovery, that's offering ourselves as living proof that recovery is real, and we provide those recovery support services that I had mentioned to maintain and sustain recovery. And you can see that we're funded by the state and other means as well. What are our foundational principles? And these are the things that aren't often in writing but are kind of the character of your organization. Early on in our organization, we sought to define recovery. I'm talking back in 1998 when we started organizing. One of the big things is, how do you tell if somebody's in recovery? Do they have to be abstinent for a certain period of time? Does it have to be 2 years to get involved? Does it have to be 20 days? What about family members? What if they're on medication? What if they're on methadone? All these ideas. Are they in recovery? We wrestled with it for 3-4 months regularly. Couldn't come up with a definition until somebody suggested this. You are in recovery if you say you are. And this is based on the 12 steps of Alcoholics Anonymous, that all that's required for membership is a what? A desire to stop drinking. Who determines if that person has a desire? That person, not the group. So this is kind of a very self-directed, that you are in recovery if you say you are. Not to say we haven't been tested on that. You know, if somebody claims to be in recovery from alcoholism and they're on the marijuana maintenance program, we might ask them, how's that working for you? You know, those kinds of questions. But it does work, and it serves us very well. I'll have you know that researchers and evaluators don't like that definition at all, because there's no assessment, there's no baseline established, there's none of that. If somebody comes into our community center, you know, our assessment is done over a period of time as we get to know them. They say, I need help getting a job. I don't have a place to live. Do you have any clothes? We can help you. You know, we start there and go from there. But they know it's a place for recovery and about recovery. This is where they come in. Many pathways to recovery. Bill White mentioned that. In the United States, my recovery, as you've probably gathered, is based in Alcoholics Anonymous, 12-step program. For many years, I was convinced that that was the way. And I have since seen hundreds and hundreds of examples that there's other ways. And they've done some research. African American women get involved with 12-step programs at the same rate as the rest of the population for that first 12 months. And then after 12 months, they disappear from 12-step programs in the United States. But they're still in recovery. Do you know where they go to support their recovery? So I heard they go back to church. They do. And I was facilitating a meeting, 12 steps in religion, adversaries, strangers, or friends. And I had some guys in recovery for 20+ years in AA, and these African American women who have been in recovery, they say, for 20+ years, involved in their ministry, helping people in the street, helping them getting into recovery. And the guys from AA told these women that they weren't really in recovery because they didn't go to meetings anymore. So I had the pleasure of facilitating that discussion. So when you look at the light in their eyes and how people respond, who is to say that another person is in recovery or not? How's that working for you? The other foundational principle, we always focus on recovery potential, not the pathology. So when someone comes in, we don't know what their diagnosis is. We just kind of say, well, what do you want to work on? It's in their hands. We always err on the side of the recovery, and that's what we call people in recovery, like an employee, refugee, recovery. And we always err on that side, err on the side of being generous. And at least in our treatment system in Connecticut, they don't err on the side of being generous. They err on the side of covering their butt, basically, that they're not going to get in trouble. And that's just the way the system is. And we're working to change that as well. So I told you we have two parts. We have advocacy, putting your face in recovery, and the recovery support services. Here's some of the advocacy pieces that we wrote some recovery core values with Advocacy Unlimited. They are a sister organization that focuses on mental health issues, and that helped the commissioner promote a recovery-oriented service system. We had Willimantic, which is almost on the back roads between Boston and New York, was a major heroin trafficking route. And they did a whole, Hartford Current is our big paper, they did a whole newspaper series that I think ended up winning a Pulitzer Prize on Willimantic and called it Heroin Town. We had the last day and talked about the recovery that was also there. The pardons process in the United States is when somebody gets convicted, this is a way that they can go through a process and have that expunged from your record. And there's times when kids have been arrested for dealing drugs in their teens. And this is the actual case that really made us think about this. And he had been in recovery for 20 plus years, had his own business, was hiring people new in recovery to work for him. And he was a contractor. And he wanted to get a roto-rooter license, and he couldn't because of this felony. And so he said, how long do people have to pay for their addiction and the penalties and their convictions? So we help them. We don't always necessarily agree that they should get a pardon or not. It's just to show them what the process is to apply for it. DEMAS is our state department, Department of Mental Health and Addiction Services. NIMBY means not in my backyard. So a lot of times when people want to start recovery houses, they get resistance from their neighborhoods. So we help testify and tell them that recovery houses are great neighbors. Their houses are well kept up. Their yards are mown and raked, and the snow is shoveled. Their bills are paid. It's painted. A lot of times, at least in the area in Connecticut, people would rather have a crack house or a crack den next to them than a recovery house. Can you figure that one out? I don't know. I know that's just the way it is where we are. And Faces and Voices of Recovery is our national organization, and we did some things with some RCSP's Recovery Community Services Program, did some things on a national level, and HBO is a television show, and so those are some other things. So these are just some highlights. And I will talk about the recovery walks. These are some other ways that we do things. We speak frequently, have a huge speaker bureau, posters, public access TV, produce DVDs and videos. Recovery community centers. And you remember the movie Field of Dreams? And what was the tagline in that? Do you remember? Build it and they will come. We certainly found that the case. If we opened the doors for our recovery community centers, people just flocked in. We have 3, and we have roughly 15,000 visits per year of people just coming in seeking help. We have a staff right now of 11 and 15,000 visits. And I'll show you how we manage that as well. So what are these? They're recovery-oriented sanctuaries in the heart of community. In Hartford, someone was looking to find us, and the neighbors, the people in the neighborhood, and this is a pretty tough neighborhood, they know us as the recovery place, not as CCAR, the recovery place. And we have had prostitutes, drug dealers, up and down the street eventually come in because they knew it was a light. It was a place where there was hope, and they came in for help. And that's even not our primary purpose, is to get people into treatment, is to help them stay in recovery once they get the treatment. And so we design recovery support services, and it's all fueled. We're able to do that by volunteers, and I'll get into that a little more too. And this is a little bit of Connecticut. New York's down there on the lower left, and Boston's over here on the right. Actually, if I go that way, it's the right. And those are where our centers are located. And these are actually what the buildings look like. We have an old Victorian home in Hartford. That's in the neighborhood. Right down the street are some crack houses and a lot of trafficking and drug dealing going on. So what are some of these recovery support services we provide? Telephone recovery support, I'll talk about that in more detail. Also about helping people find jobs. Also talk more about housing. And the All Recovery Group is simply a non-denominational group where people come in, and they could be from Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, Gamblers Anonymous. They could be on methadone. They could be family members. And not that we always know that because we don't ask, but their common theme is to just come in and talk about recovery and close with a positive affirmation. I didn't think it would work. I was proven wrong. They have anywhere on a 12:30 in the afternoon, they have 40 to 50 people at every meeting they hold. The people that just find a different kind of home here. And we never set out to do this kind of thing. There isn't a 12-step flare. A lot of 12-step members go to it. But it's even rare to see AA and NA members in the same room. I don't know if it's any different here, but it's rare in Connecticut to see those people in the same room working on their recovery. We do a lot of different trainings to help people get high school education, work on their relationships. The idea of Recovery Community Center, it's not a place to hang out. It's a place to work on your recovery. It's not a place to play pool or cards. It's a place to work on your recovery. So we encourage all kinds of workshops and trainings so people are there to work on their recovery and they have each other helping. We have recovery coaching, and I'll talk a little bit about that. Social events are a huge part of it. For example, we had a Halloween dance, and I talked about the drug dealers. He showed up, and they knew, the volunteers and people running the dance knew who he was, and said, "You can't bring your goods in here." And he said, "Okay," and he left. 15, 20 minutes later, he showed up with his wife and 2 kids. So even the drug dealer in the neighborhood knew there was a need for clean and sober social events, that kind of thing. It's just incredible stories. And we have karaoke nights and all kinds of talent shows, and they just love to have fun in recovery. It's important for people to see you can have a lot of fun in recovery. And we also help them navigate the system. Nobody better to navigate the system than people that have been through it multiple times.